Hello, my name's Sarah Delaney and I'm the Research Support Officer with Health Research Charities Ireland, and I'm going to give you an overview of the HRCI-HRB Joint Funding Scheme and how it works. So what is the HRCI-HRB Joint Funding Scheme? It brings together members of HRCI and the Health Research Board, or HRB, to fund patient-focused research. It co-funds research projects of key relevance to member charities. The HRB provides dedicated funding and primary grant management responsibility, and HRCI provides the first point of contact for the scheme and manages charity involvement. So what makes the HRCI-HRB Joint Funding Scheme unique? It's a unique scheme with no known international parallels. It has a very high relative success rate, with an average of 60% of projects submitted to the HRB approved over the last 5 years. It's open to almost all types of research and is particularly beneficial for rare disease research. It has a strong focus on PPI, and it was the first HRB funding scheme to include public, patient and carer involvement PPI reviewers on the review panel. It has high impact compared with other HRB schemes, and overall it promotes patient-focused research and builds capacity amongst HRCI members. So how is the scheme funded? HRB provides 50% of the cost of a successful project, and the charity provides the other 50% of the cost. For very small charities whose revenue is under 150,000, the HRB provides 75% of the cost of the project and the charity 25%, and it should be noted that the HRB's contribution is paid directly to the research institution. The HRB makes a €1 million annual contribution to projects funded under the scheme, and each award is worth up to €300,000 combined charity and HRB funding for projects from 12 up to 36 months. The eligible costs covered by the scheme include personnel costs excluding tenured staff, student stipends and fees, direct running costs and dissemination costs. So, in terms of types of research supported by the Joint Funding Scheme, almost every type of research relevant to patients is funded under the scheme. This includes patient-oriented research, such as research that focuses on better results for the patients, and examples include new cancer therapies, testing for early detection of diseases such as Alzheimer's disease, or improving treatments for infectious diseases. Health services research is also funded under the scheme, and this is research focusing on the delivery of healthcare services in Ireland. This includes investigating hand hygiene in hospital workers, examples such as self-management of chronic conditions such as chronic pain, or transition from child to adult care for people with chronic illness. Population health research is research that focuses on the prevention of ill health and promotion of well-being, and examples of research funded in this category include prevention of disease, such as those linked to obesity, or inequalities in access to GP care in Ireland. However, not all types of research are funded under the scheme, and there are some types of research which are not funded. Applications which are solely literature reviews, audits, surveys, or needs assessments or technology development are not funded, although these elements may be part of an integrated research study. Studies evaluating full-scale definitive interventions to provide high-quality evidence on the efficacy, effectiveness, cost and broad impact of the intervention, and standalone feasibility studies conducted in preparation for a future definitive intervention are not funded. These studies are supported through the HRB Definitive Intervention and Feasibility Award Scheme. Applications which are solely or predominantly developing infrastructure for biobanking databases or patient registers without a predominant research element are not funded. What's not funded as well is applications which are solely or predominantly health service developments or implementation of an intervention without a predominant research element. The HRB will not fund the costs of providing the service or intervention itself, only the research element. Applications from individuals applying for, holding or employed under a research grant from the tobacco industry are not supported, and research intended to create human embryos solely for the purpose of research or for the purpose of stem cell procurement, including by means of somatic cell nuclear transfer, are not funded. However, Applicants can propose work to develop a healthcare intervention. Such work may include some initial testing of the intervention in order to generate proof of concept data and thus have the basis for developing a feasibility study. This would mean that applicants could then apply to HRB or another funder to support a feasibility study as a next step. In such cases, applicants must consult with the appropriate clinical research infrastructure supports, such as the clinical research facilities, to ensure that the work done will allow them to develop a feasibility study subsequent to the HRB or charity-funded research. So in terms of eligibility then, principal investigators who lead the research team applying for the scheme must either hold a post that covers the duration of the award in a recognised research institution as an independent investigator, or be a contract researcher recognised by the research institution, or be an individual who will be recognised as a contract researcher by the research institution. The principal investigator's contract must cover the duration of the award, and this is to be confirmed at application submission stage. PIs must have at least 3 peer-reviewed publications and at least 1 peer-reviewed research grant as lead applicant or co-applicant, and only 1 application per PI will be considered. The PI can be based outside Ireland in specific circumstances. A signed warrant must be provided in this case at the application stage. All applications must be made to the HRCI member charities on or before their set closing dates. It's a good idea to start building partnerships with member charities early in order to collaborate effectively on the research topics that have been prioritised by charities. HRCI's website on the Joint Funding Scheme provides comprehensive information about the scheme and advertises member charities' open calls when they're launched, so keep an eye on our website and on our Twitter feed. It should be noted that charities who participate in the scheme must be full members of HRCI. In terms of collaboration then, co-funding is possible between up to 4 Irish charities, all of whom must be HRCI members. Collaboration between one Irish charity who's a HRCI member and an international charity is also possible. And funding of research teams outside Ireland is allowed where there's no established research capacity in Ireland, for example in the case of rare diseases. If the research team includes an international research institution, it's wise to work on contracting issues well in advance of submission. The HRB can provide their standard terms and conditions templates for you to review in this case. So in terms of how the scheme works overall, the first phase is charity review. Charities publish their calls and engage with prospective applicants. Applications are submitted to the relevant charity, and the charity manages international peer review and public review where applicable. The charity then offers applicants a right to respond to peer reviews, and we move on to the second phase, which is charity selection. In this phase, the charity undertakes an internal process to select proposals to go forward for consideration by the International Review Panel. At the review panel meeting, proposals are considered and each proposal is assessed by assigned scientific and PPI reviewers. The proposal is scored for scientific merit and also rated for quality of PPI, and charities can be observers at this panel meeting. Finally then, the HRB board approves successful projects and contracts are issued and research can begin. In terms of timelines for the 2021 call, this is a preliminary schedule that has yet to be finalised. So provisionally, the launch of the next round of the scheme is envisaged to take place in early autumn 2021, with charity calls opening in autumn 2021, and the deadline for submission of proposals to the HRB to take place in early spring 2022. The GEM system will be used again this year to submit applications, and it's important to keep an eye on the HRCI website and Twitter feed for updates on this timeline and for open calls. So in terms of PPI in the scheme, PPI is integrated throughout the joint funding scheme. There are specific questions set out in the application form, and this is provided here. In addition to these questions in the application form, at the review panel meeting, PPI is reviewed in the applications, and an overall rating of PPI is used to reach the consensus panel score. It's important, therefore, to think about PPI from the very start of your research project. So in terms of your own PPI approach, charities are skilled in PPI and may be able to advise and support you. We have prepared video case studies of successful projects, including patient perspectives, and links to these will be provided at the end of this video. We are also in the process of preparing case studies of excellent PPI in the Joint Funding Scheme, and we'll provide links to these when they have been finalised. The HRCI has important resources on its website, such as the PPI Toolkit for Making a Start to Begin a PPI Relationship, produced with TCD, PPI Ignite, and a guide to developing a PPI strategy, also available on the website. Local PPI teams can help if you're based in an Irish university, and the recently established National PPI Network builds capacity for good PPI. So final tips for you to take away with you. It's important to be proactive now, to think about your research priorities and how they might match up with charities, and to think about your PPI approach. It is important to consider whether your research lines up with the charity priorities. And it's important not to continue unless you're serious about patient and public benefit. Researcher priorities may be different from charity priorities. You should start giving thought to the PPI section of the application, and it would be important to line up an experienced research design and statistics expert if this is appropriate for your research, because many projects fail at panel review due to poor methodological or statistical design. So for further information, you can go to our website HRCI.ie and our pages on the Joint Funding Scheme, which will provide you with information on timelines, open calls, how the scheme works, and who to contact to get more information. You can also go to the HRB website on the Joint Funding Scheme, which will give you details of the opening and closing dates, open calls, guidance for researchers, guidance for charities, FAQs and timelines. Alternatively, you can contact me, Dr. Sarah Delaney, Research Support Officer with HRCI, by emailing sarah@hrci.ie. I hope this presentation has been useful. Keep watching to get some other perspectives on the Joint Funding Scheme, including Minister for Health Stephen Donnelly, Dr. Mairead O'Driscoll, Chief Executive of the HRB, our members, and HRCI CEO, Dr. Avril Kennan.